kailangang gawin ang APGAR scoring kasi nga po gusto natin makita kung yung mga bata ba ay nakaka-adjust ng maigi or hindi. Alright? So ulitin natin ha. The APGAR score is done on the first minute of life to determine the immediate well-being of the newborn. Right? Pero yung pangalawang APGAR score mo, which is done on the 5th minute of life, it is done po to see if the child is adjusting healthily to the outside world. Alright? So, dalawang beses po ginagawa si APGAR score. So, paano po siya ginagawa? We will be grading the score of the newborn, okay, using several parameters in the APGAR score. So, anong pinaka-importante ditong tinitignan natin? It's the heart rate. Pag yung bata po, wala na siyang pulso, okay, wala kang nakuhang pulso, you give him a score of 0. Pero pag yung bata, meron siyang apical pulse, meron siyang pulse rate, pero mahina, okay, or mabagal, kunwari, less than 100 beats per minute lang, you give a score of 1. But if the child's heart rate is more than 100 beats per minute, you give a score of 2. Okay? So, ganun lang po yung APGAR scoring. We just look at the vital signs. We just look at the reaction of the child. And then, based on the reaction na ibibigay ng bata, we give a score. Alright? So, yung heart rate po, ang ginagamit natin is the apical pulse or yung pulso po doon sa below the nipple line. Alright? So, 0, ang ibibigay ng score pag walang pulso or absent. 1, if it is less than 100 beats per minute. We give a score of 2 if the child has more than 100 beats per minute na heart rate. Next, we also look into the respiratory effort of the child. Humihinga ba siya ng maigi? If the child's breathing is absent, wala kang nakikitang rise and falling of the chest, you give a score of 0. Pero yung bata, the child has slow, irregular, or weak cry, nugsang sangit ke, basit, or agan-angis ke, nabuntog, nga irregular, you just give a score of 1. But if the child has good breathing or the child has strong cry, you give a score of 2. Bakit, sir, kailangan nating pinapaiyak yung bata para bigyan ng mataas na score? Always remember that crying is the surest sign of breathing. Yung bata na hindi umiiyak, ibig sabihin, hindi yun humihinga. Okay? Lahat ng mga batang umiiyak, ibig sabihin humihinga. So those are your signs that you have to look into if you are assessing the respiratory effort. Next, we also look into the muscle tonicity. Yung muscle tone naman ng bata. Always remember po, no, na yung mga newborns, if they are delivered, they immediately assume a fetal position. In Ilocano, agkukot tagita nga ubing. Okay. Tagamin, number 1 is they are protecting themselves from hypothermia. Di ka di agkukot na dagita kasi laminenda. And then aside from that, they are still assuming the position that they did while they were still inside the womb of the mother. So yun po yung titignan natin, yung muscle tone ng bata. Pag yung bata po ay parang lantang gulay na naka-straight lang yung upper and lower extremities niya, hanggang nakakukot, kaya nasa Mendeta, you give a score of 0 because there is flaccid muscle tonicity. However, if the child shows some flexion on the upper extremities, adamit kaya diti flexion na, ngayon haanmet nga nakakukot nga permi, you just give a score of 1. But if the child is well flexed or if the child is assuming the fetal position, then you give a score of 2. So that is what you look into in the muscle tonicity. Kung flaccid ba or langtang gulay, 0. Kung may flexion pero konti lang, hindi ganoon ka-defined yung kanyang muscle tonicity, you give a score of 1. But if the child is completely flexed or assuming the fetal position, you give a score of 2. Next, we also look into the reflex irritability of the child. Paano naman po natin titignan yung reflex? Okay? We can do that using 2 manners. Yung una po is we will insert a nasal catheter on the nostrils of the child. Agiserrek tayo ti at tube. Okay? Suction tube. No dumati usarin tayo pay kadeta to elicit the reflex or the reaction of the child. Okay? The other method is by slapping the sole of the foot. Okay? Si patenda de saka de ubing. We will look into the reflex or reaction of the child if the child deserves 0, 1, or 2. Okay, so unahin natin yung inserting a catheter on the nostril. Kunwari po, we are inserting a catheter on the nostril of the child pero walang response yung bata. Okay? So yung bata, deadma lang sa ginawa mo. You give a score of 0. But if the child shows a little grimace or nag-make face siya ng konti, kuna na laing basit, you give a score of 1. But if the child coughs or sneezes or umiyak ng malakas after mo siyang ininsertan ng nasal catheter, you give a score of 2. So that's how you look into the reflex irritability while using the nasal catheter. Pero kung wala ka naman pong nasal catheter, you can also use the second method, which is slapping the sole of the foot. Si paten tayo de jimukod tisaka de ubing. If the child's reaction is none or wala naman siyang response, deadma lang sa pagpalo mo sa kanyang sole of the foot, you just give a score of 0. Pero pag yung bata nagkaroon ng grimace, nag-make face siya ng konti, pinakita niyang nasaktan siya pero hanggang sa facial expression lang, you just give a score of 1. But if the child cries or withdraws the foot, you also give a score of 2. So ganun po yung gagawin natin in the reflex irritability. Lastly, we will assess the child using the color. Okay? Anong gagawin natin? We look at the skin of the child. Pag yung bata po ay completely color blue, litem in Ilocano, or pale, you just give a score of 0. Kasi ibig sabihin niyan, pangit yung kanyang circulation ng dugo. Pero pag yung bata naman po, yung color niya is acrocyanotic. When we say acrocyanotic po, the child's body is pink, but the peripheral organs, yung mga upper and lower extremities niya ay color blue. O so ma-imagine nyo, pink deje bagina, and then color blue, aglilitem deje yanti imakinsaka na, you give a score of 1. But if the child is completely pink all over, you give a score of 2. So ganun po ang gagawin natin when assessing the color of the child. So yun nga, natapos mo na pong gawin yung kanyang reflex, yung heart rate, respiration, muscle tone, and color. Na-assess mo ng lahat yung mga yon. Ano nang next na gagawin mo in the APGAR score? After giving the child the score that they deserve, the next thing that you are going to do is add the scores. I-add natin ito, total natin lahat. And then, what you're going to do next is decide upon the health status of the child. Okay, so i-add natin silang lahat. And then, pag yung bata, ang meron lang na score niya is 1, 2, or 3, that means that the newborn is in serious danger and that the child may need resuscitation. Okay? So yung bata, pag 1, 2, or 3 lang po ang score niya, baka kailangan niya pong ma-resuscitate or kailangan na pong tumawag ng doktor because the doctor may do CPR, suctioning, or giving medications like epinephrine. Ibig sabihin nito, yung bata nag-aagaw buhay. But if the child's scores fall under 4, 5, or 6, that means that the condition is guarded. Anong ibig sabihin nito? The child may need supplementary oxygenation. Baka kailangan lang po niyang mabigyan ng additional oxygen or the child may only need clearing of the airway. Baka kailangan lang ng konting suctioning para mag-improve yung kanyang condition. So I repeat pag 4, 5, or 6 po yung condition ng bata, we call that condition guarded. And the child may need supplementary oxygenation. Baka kailangan lang bigyan ng oxygen or i-clear yung kanyang airway using suctioning. Okay? So anong gagawin natin pag yung mga pasyente po natin meron siyang 4, 5, or 6 na score? We give oxygen via face mask or cannula. So yun po yung gagamitin natin. But if the child's score falls under 7, 8, 9, or 10, that means that the condition of the child is good. So anong kailangan lang natin gawin? We will only need monitoring. Okay, so kailangan lang i-supervise and i-monitor just in case magbago yung kanyang condition. Alright, so like I said a while ago, gagamitin natin ito on the first minute of life. And then, gagawin ulit natin yung same assessment na ginawa natin on the 5th minute of life to know if the child is adjusting well. So, yung una po, ginagawa natin yung APGAR score para malaman natin kung yung bata ba ay okay naman yung condition immediately after niyang pinanganak. Yung second APGAR score na ginagawa natin on the 5th minute of life, that is done to assess how well the newborn is adjusting. Okay, so sir, may mga pagkakataon po bang nagbabago yung condition ng bata? Yes, most of the time. Good ka lang. Sorry po, that's just my lola. Medyo senile na kasi. Kaya ganun yung reaction. So, anyway, so like I said a while ago, ang gagawin natin is, sir, may mga chances ba na nagbabago yung situation ng newborn? Yes, may mga newborn po na pinapanganak silang okay on the 10th, on the first minute of life, pero after 5 minutes, pumapangit yung condition. So that's the importance of doing the APGAR score. Kailangan natin gawin yung APGAR score para makita natin talaga kung okay ba nung pinanganak yung bata or hindi ba nakaka-adjust yung bata ng maigi. Alright. So we proceed to the vital signs of the neonate. Always remember that when we are assessing the heart rate of the child, we use the cardiac or the heart rate, I should say, when we are assessing the pulse rate. Okay? So ano yung gagamitin nating pulso when we are assessing the pulse rate of the child? We will be using the apical pulse. Okay? So anong ibig sabihin ng apical pulse? That is your heart rate. Okay? That's just another term for your heart rate. And the apical pulse is usually located lateral or along the nipple line at the fourth intercostal space. So pag tinatanong nila in the board exams kung saan yung exact location ng inyong heart rate, it is lateral to the nipple line at the left intercostal space. So batog iso na nipples and located on the intercostal space na pang-apat. So when you say intercostal space, these are the spaces in between your ribs. All right. So what is the normal heart rate ng mga newborn? The normal heart rate of the newborn is 160 to 180 beats per minute pag immediately after delivery. So pag kapapanganak pa lang yung bata, usually mataas yung kanyang heart rate, 160 to 180 beats per minute. But it also stabilizes at nagno-normalize siya up to 120 to 160 beats per minute. Okay, so sir, bakit siya tumataas po yung 100 yung heart rate ng bata? Bakit nagiging 160 to 180? Tumataas yan because the child has been exposed to certain mechanical manipulation, na-IE yung nanay, so meaning masagid-sagid yung ulo na or maipit-ipit so na using the uterus while it is still contracting. So normal na tumataas talaga yung heart rate ng newborn on the first few minutes of life. Pero nagno-normalize naman siya to 120 to 160. You have to remember that the radial pulse or yung pulso po dito sa may wrist area natin, the radial pulse should not be prominent. Dapat po pag kinakapa mo yan, wala ka dapat ma-feel na pulse. Bakit? Kasi that's normal. Kung walang nafe-feel na pulso sa may wrist area, normal lang po yun because the radial pulse is not really prominent immediately after delivery. But, if kunwari inassess mo yung radial pulse ng bata, meron kang na-feel, okay, merong pulso, that may already indicate congenital anomaly of the heart. So, maaaring meron siyang sakit sa puso. So you immediately refer this condition to the doctor. Sabihin mo, Doc, I assess the radial pulse of the child and the radial pulse is prominent. Alright? So sasabihin ng doktor, wow, talino naman ng midwife na to. Alam na alam niya na may possible patent ductus arteriosus yung bata. So para meron siyang heart condition, which you will learn later on as we go along the discussion. Alright. When we look into the respiratory rate, the normal respiration of the child is rapid. Mabilis yung mga respiration ng newborn. Ano pa? Aside from it being rapid, it is also irregular. Wala siyang pattern. Unlike kanya tayo nga, ganun tayo, sila, may mga patterns of irregularity. Okay? Ano pa? It is also shallow and abdominal diaphragmatic. Pag humihinga po yung bata, yung hangin pumupunta po sa abdomen or diaphragm. So, unlike for us adults na yung chest ang nagra-rise and fall, dito naman po sa mga newborns, yung tiyan naman nila yung lumalaki. Kasi nga yung breathing nila is abdominal diaphragmatic. Okay? So, laglagitan nyo DJ. Next, there is, bakit rapid, irregular at shallow po yung breathing ng bata? Irregular siya because the respiratory center, the respiratory center of the brain of the child is still underdeveloped. And ano ba yung parte ng utak na nagko-control sa paghinga ng bata? Kaya ganun pa lang, irregular pa lang yung breathing ng bata. It's what we call the medulla oblongata. Because of the medulla oblongata being underdeveloped, nagiging irregular po yung breathing. Pero as the child's medulla oblongata develops, magiging regular na din po yung kanyang paghinga. Alright? Next, the normal respiratory rate of the newborn is 50 to 80 cycles per minute. So, makikita nyo ang bilis ng paghinga niya, especially at birth. Okay? So, normal lang po yan. Kung ganun kabilis, 50 to 80 cycles per minute, that's just normal. But, it normalizes at 30 to 60 cycles per minute pag naka-relax na yung bata. Always remember that if the child is exposed to tremendous amounts of pain, pressure on the during the first minutes of delivery, so anong mangyayari? Talagang bibilis yung kanyang respiratory rate. Now, always remember po na normal lang po na makakita tayo ng periods of physiologic apnea. When we say physiologic apnea, these are the absence of breathing for less than 15 seconds. So, sir, dati ba di iwagbagada nga matiili di ubing? Yes. We call that physiologic apnea. Normal lang po yan sa mga bata pag hindi sila humihinga ng more than 15 seconds. Like I said, yung kanilang respiratory center of the brain is still underdeveloped. Okay? So normal lang po yun. Pag yung kanilang apnea is less than 15 seconds. So sir, kailan ito usually nakikita? The physiologic apnea, yung hindi niya paghinga ng 15 seconds, is usually observed during rapid eye movement a few minutes before sleeping. So makita yu dejo ubing, rugyan na ti maturog detan, no? Napaspas ng agkuti-kuti dejo matana. Okay? So DJ mo nga makita met dejo physiologic apnea when dejo hanga pinagangis dejo ubing for 15 seconds. So next, we also look into the blood pressure. So sir, kinukuha ba talaga yung BP ng bata? Yes. But in the Philippines, that is somehow not done kasi we do not have the proper apparatus to gauge the blood pressure. Pero for discussion purposes, maganda kung alam po ninyo yung kanilang normal na BP. Okay? So yung normal BP po ng bata is normally 75/42. Okay? Yung systolic pressure niya, naglalaro yan sa 60/80. DJ nga to, ti over. Okay? That's the systolic pressure. That's 60 to 80. That's normal. And yung diastolic pressure naman nila is normally 40/50. Yung 75/42, that is the blood pressure that is expected immediately after the delivery of the child. Pero nagno-normalize yan at 60 to 80 sa systolic and 40 to 50 sa diastolic. Now, always remember that the BP or the blood pressure on the upper extremity should be the same as the BP that you get in the lower extremity. No mano ti binipim ko mga naalam ka yan ti ima na, isumit ti maalam ka dejay saka na, dapat nga BP. Ngem, no agsabali dagita, if there is a difference between the upper and lower extremity pressure, then it may also mean that the child has congenital heart defects. And that is what we call coarctation of the aorta. I repeat, agparis dapat ti maalang nga blood pressure on the upper and lower extremity. But if you have a difference between the upper and lower extremity pressure, that may be an abnormality which is called the coarctation of the aorta. So merong sakit sa puso yung bata. Yung mga great blood vessels niya nagkapalit. Alright. Now, always remember that we are following the EINC Protocol or the Essential Intrapartal Newborn Care Protocol, and this is based on a systemic search and critical appraisal of foreign and local research studies. So bakit natin ginagawa yung EINC Protocol? Kasi may mga best practices kasi na ginagawa yung mga other hospitals abroad that has led to 4 time-bound interventions. So dahil sa mga research studies na ginagawa para mapakonte yung mga batang namamatay, nagkaroon tayo ng EINC protocol. And ano yung gagawin natin? Immediately after the delivery of the child based on the EINC protocol. Ito po yun. Number 1 is we immediately thorough dry the newborn. Number 2 is we also do early skin-to-skin contact, which will be followed by properly timed clamping and cutting of the cord after 1 to 3 minutes. And after that, there should be non-separation of the newborn from the mother for early breastfeeding initiation and grooming in. So, nya kaya na sa Wendeto, these are the steps that we need to follow as healthcare providers. Amuyo, when I was still studying in my midwifery school, ang unang ginagawa namin after the delivery of the child, primordial ubingin, di ba? What we do is immediately clamp, cut. Okay? Clamp midi-cord, we cut. And then, sumarnong obrami, padigos and misigod di ubingin. No napadigos di ubingin, immediately, dinadaan namin sa nilalagay na namin siya sa NICU or the Neonatal Intensive Care Unit. Han nga makita insigida ni nanang DJ ubing. Kasi nga, we immediately separate the newborn from the child. But because of research studies, it has been found out na hindi pala healthy practice ang mga ganito. Alright? So, anong gagawin natin is that we have to follow these protocols para po maiwasan yung mga untoward effects of these to the newborn and the mother. So again ito po yung mga pagkasunod-sunod na dapat ginagawa natin. We immediately and thoroughly dry the newborn. We do early skin-to-skin contact. We clamp and cut the cord properly timed after 1 to 3 minutes. And then there should be non-separation of the newborn from the mother. Now, we look into the care of the newborn at birth, and yung unang responsibility natin as midwives is to provide warmth and heat to the newborn. Aside from that, we also have to regulate the temperature of the newborn, and we also need to maintain a neutral environment. So yun po yung mga kailangan natin gawin. Dapat painitin natin yung newborn. Kasi majority of the people or newborns that die is because of hypothermia. So yun po yung unang kailangan nating gawin. We have to provide warmth. So paano ba nawawala kasi yung heat? There is what we call convection or nawawala yung heat sa katawan natin because of the presence of cold air. Okay? Di ba no nalamin DJ yan ti angin ke pati si kaglamlamis kan tumeten. So that is one method of heat loss. Aside from that, we also have what we call conduction or cold hands. No anya di direkta nga mapandi ti imam or kudil mo, that will cause heat loss. So pansinin niyo di ti napudutan ko mga tugaw. Okay, ti motor. Di ba nagsakit ng tugaw ka insigida ka di maliling ta deta manim when matutuno deta latig mo. Okay? So yung pamayan nyo, di ba, idepedepel yung data imayo? Why? Because there is transfer of heat from that surface to your hands. So kas jay metlaeng apo no nalamiis nga ima ti mangigigem ka di ubing. The more cold hands that touch the newborn, the more heat is lost. Next method of heat loss is what we call evaporation. Nakikita natin ito using the TSB. Okay? Nagkakaroon po tayo ng heat loss through the skin surface. So, di ubing, di ba, no nabara, punas-punasan tayo sunati nalamiis nga tuwalya, okay? Or punas-punasan tayo ti danom, niya ti mapasamak. Nag-evaporate po yung heat because of that. So, that is another method of heat loss. Aside from that, we also have radiation. Dito yung radiation is almost the same as your conduction, pero there is indirect contact. Kunwari, example niya, amoy di bassinet. Di bassinet gamin ke metal DJ nga crib DJ ubing. Okay, it's metal. So, DJ delivery room nalamiis, di kadi because the aircon is turned on. DJ yanti aircon, palamlamiisen na DJ crib or the bassinet which is metal. Kaya iso tinagidaan DJ ubing. So gaputa nakalamlamiis DJ nga metal, there is radiation coming from the heat is being radiated, cold is being radiated from the metal parts of the bassinet going to the newborn. So mapalpalikawan DJ ubing tinalamiis nga banag, that which is your bassinet, which will now cause heat loss. All right. So sir, aping nga kitain tayo detoy, aping nga masapol tayo nga amuen detoy, because if we know how heat is lost, we will know how to control it. Okay? So laglagipin niya apo niya nga ti kaaduan nga ubing mamatay da because of hypothermia. And hypothermia means subnormal temperature, which is common in newborns. Kaya sa tinawag na hypothermia kasi hypo meaning nababa, thermia meaning DJ yan tipudot. So nababa nga pudot DJ ubing or nababa nga temperature na. Okay? So that is the usual cause of death of newborns. So ano ba yung mga causes? Sir, aping nga nagdaras nga mga laminen dagito ubing. The number one cause of hypothermia is that the hypothalamus is still underdeveloped. Okay? Apa yan nga ngamin deta hypothalamus, sir? Your hypothalamus is the thermoregulation center of the brain. Laglagipin nyo kasla deta metlaing DJ yan ti medulla oblongata. Deta hypothalamus ti mangkon-control ti temperatura DJ ubing. Now, if the hypothalamus is underdeveloped, meaning han na pay nga kaya nga kontrolen mismo DJ temperatura DJ katawan DJ newborn. Okay? So, because of that, because of the underdeveloped hypothalamus, hindi kayang kontrolin ng katawan natin yung ating temperature, the newborn automatically assumes the flexed position. Okay, so nagkukut immediately di ubingin, that is a reflex to help guard against heat loss. Di ba da kayo no, kunwari kaimas na ti turog yu kuma, and then natin nagdejay ules, di ba agkukut kayo no, masadot kayo nga mangpidot ka dejay ules nga natin nag. So agkukut kayo, you assume the flexed position because it also helps guard against heat loss. So deta met ti ubrain dejo ubing agkukut met isuna tanuhaan nga laminen. Okay. Aside from that, another cause of hypothermia is that the newborns have less subcutaneous or adipose tissue. Na kaya nasawen detoy, yung newborns po kasi konti lang yung kanilang fats. Okay, subcutaneous fats or adipose tissue. Di ba tikunada no nalumig ti mesa nga tao narigat so na nga laminen kasi dati built-in jacket na. Ustumit actually DJ because the fats of the newborn will help to insulate the body of the child. Alright? Next, aside from that, meron ding konting stored brown fats kasi yung newborn. Okay? Excuse me lang, sandali lang ha. Naka-focus ni sir. Okay, so hindi. Wait lang. Sorry, may mga nag-a-add na hindi ko, may mga nagjo-join na hindi ko na-add. Sorry. Alright. So I hope the others have already joined the meeting. Okay, next. Another cause po ng hypothermia is that the newborns have less stored brown fats. Dito nga brown fats tayo, they are necessary for heat production. Kunwari kung manulamlaminin tayo, di ba? For us newborns, meron na tayong mga brown fats na tinatawag. Yung brown fats na yon, these are burned by the body. Pupuuran di gibagi tayo dejay to create our own heat. Isu nga rod nga no, deji tayo kuma Amerika, Canada, barbaring kumaki din no maka-abroad tayo amin. No, deji tayo, hantayo nga matay insigida because we have brown fats. Dito nga brown fats, it is used by the body to produce heat. Now, the problem is, newborns have very low levels of brown fats. Isu nga awanti, puuranda nga taba, pumudot deji bagida. So those are the three causes of hypothermia in the newborn. Isu nga kaadwan kanyada, kay matay because of a hypothermia or uncontrolled temperature. Number 1, nadaras da nga laminin, tagamin the hypothalamus is still underdeveloped. Number 2, nadaras da nga laminin because they have less subcutaneous or adipose tissues. Number 3, awanti brown fats daw which are necessary for heat production. So because of that knowledge, amo tayo tatan nga dagiti nga ubing ket nadaras da nga laminin. And it is our responsibility as a midwife to always thermoregulate the child. All right. Now, so what do we do? Tanuhaan nga laminen de ubing. Number 1 is we promote or we do immediate thorough drying. So according to the protocol of the essential intrapartum newborn care, ang unang gagawin natin is that we dry the newborn thoroughly for at least 30 seconds using a clean, dry linen. So dapat, pag magpapaanak po tayo, meron na tayong dalawa, at least 2 dry linens. Okay? 2 nga lampin, timasapul tayo. The first one will be used to dry the newborn thoroughly for 30 seconds. Okay? Apay, sir, nga masapul tayo nga i-dry de ubing. Nabasa ka disuna? Yes. Nabasa de ubing because the child is exposed to amniotic fluid. Deta de ginaglanglanguyan na, sabay suna nga, nayanak. Napadasan nyo may nga tati na nag-swimmingin nga awan tinaytugot yung atwalya and then nagpapamagakailatan. What happens? Nagsakit kayo kasi linamin kayo. Ikadi. Okay, so that can also happen to the newborn if we do not dry the newborn immediately. So again, we thoroughly dry the newborn using a clean, dry linen for at least 30 seconds immediately after birth. Pagkayanak pa lang di ubing, katsyen yun, and then punasan nyo insigidan, isunan while the child is on top of the abdomen of the mother. Alright. Next, habang po, dinadry natin yung newborn, di ba? Pampamagain tayo nga rodin, di ka di? While we are drying the newborn on the first 30 seconds, dapat i-check na din natin kung humihinga ba yung bata or hindi. Because that is also part of our assessment in the APGAR scoring. So habang papamagaim de ubingin, kit kita emeten na agang angis isunan when no haan. Alright? So aside from that, always remember that 95% po of newborns can breathe normally after birth. Okay? Agangis din sigida dagita after birth immediately, even without suction. Okay? Makaangis da dagita. Now, when you are drying the newborn, you have to follow an organized sequence. Dapat adalata sursurutin tayo mga steps while we are thoroughly drying the newborn for at least 30 seconds. We start with the mouth. Punasan tayo jingiwat de ubing. And then nose. Okay, punasan tayo agong de ubing. Apay, tagamin just in case no aganges to detan, punana at least wala na siyang ma-aspirate or masaswallow na amniotic fluid. Okay? Or any discharge coming from the mouth or nose. So, umuna sa ngiwat, puna sa nagong, and then rub the back. Okay? I-rub yun di likod nan, taano, stimulate yun di ubingin nga ag, sangit. Okay? Always remember that when you want the child to cry, di likod ti i-rub tayo. And then, no nagsangit di ubingin, or no nagangisen, we follow the cephalocaudal manner. Irogi di ulo, agpababa di ti trunk, upper extremity, lower extremity, maudi lata ti genital area ken diaper area. So that's what we follow as a sequence in our thorough drying. Now, always remember to wipe gently. Haan yung unay nga ranggasan met ati, manggel-gel ka de ubing, baka kay din to mapisang-pisangin de kudil na. Okay, you gently wipe the newborn. Dati-dati po, tinatanggal namin yung vernix caseosa, which is the cheese-like covering that is in the skin of the newborn. Okay? Deji kasla cheese, titsura na deji nga deji yan tikudilda. Dati tinatanggal po namin yun lahat. Pero ngayon, in our immediate thorough drying, hindi na natin siya tinatanggal ng lahat-lahat. Okay? We just spread it across the skin of the newborn. Imilamil tayo lang dejay. I-spread tayo on the skin of the child. Sir, apim nga nga maikat ti vernix caseosa because it is known to have antibacterial properties. So kitain nyo man niya, kaya pala niyang pumuksa ng mga microorganisms that may be dangerous to the health of the child. So, imilamil tayo laing the vernix caseosa on the skin. We just spread it normally. Okay? Because that will also serve as an insulator para hindi mag-escape yung heat. And aside from that, it also has antibacterial properties. We do not need to wipe off the vernix caseosa. Alright? So next po na gagawin natin is, after niya i-dry tayo dejay, waras-waras tayo dejay vernix caseosan, syempre nabasan tumetten dejay cloth nga inusar tayo or the dry linen nga inusar tayo. So what do? You remove the wet cloth. Okay? Ikatan nyo yung wet cloth and then you replace it with a dry one. And then, no masapulat ta nga i-thorough dry tayo ni newborn, no nabasalat ta, ituloy tayo latas na nga i-dry. Now, habang i-dry nyo ni newborn, napansin nyo po that the newborn is not breathing. What do? You stimulate the newborn to cry by drying. Okay? So, nyo tipamayan tayo. Dati-dati, tipamayanda, si patenda di ubet di ubing, di ba? Wenuhan ke, gunggunin di ubing. Okay? Madidejay nga practice. Okay? Do not slap or shake the baby because that can lead to physical trauma. Okay? Or pwedeng magkaroon ng bruising. Mabaling agpasa di ubing and mabaling makaswang ka as a midwife. Makulong ka because of that. So, hindi na po pwedeng pinapalo natin yung newborn para lang po siya huminga or umiyak. The best thing that we need to do is we just rub the back. Okay? No hanggang sangit, Jobing, just rub the back. Hanggang sangit, rub the back. Ganun lang. Hindi po pwedeng sipat-sipatin, gunggunin, and so on and so forth. Next. Always remember that you do not need to ventilate the newborn. Nya ti ventilate nga kunada kay deja agipanda ti nasal cannula when no deja kasla mask, oxygen mask, kasya hanga masapol deja. We only do that if the newborn is floppy or limp when no lamtang gulay nga kasya yan awan ti kare reaction no deja muscle tone nan. Or the child is not breathing. That's the only time that we give ventilation. But most of the time hindi na nila kailangan yon. Next, suctioning. Ginagawa pa ba natin yun? Yes. We only do suctioning if we can see that the mouth and the nose has blocked secretions. Okay? Or it is blocked by secretions, I should say. Ngim dati-dati ang muyo niya, idida kami ti estudyante, pagkarwar de ubing, inalamin, sinaksyon min. Kasi nakatlaki de kordan, sinaksyonin. That's what we call routine suctioning. Hindi na po natin ginagawa yan. Because the newborns can expel the secretions on their mouth and nose naturally on their own. ngem no kakarab mo ti likod na abiham ilang nga gangisen ko nam kinitam ki ayapo dagam tinagdakkel nga timmangken nga secretions diyan ti agong nang hanga maikat, that's the only time that you use the suction. Alright. So nung nalpas mo diyan, the next thing that you're going to do is promote skin-to-skin contact. Ano natin siya ginagawa? After the delivery of the mother, the baby is placed on the exposed chest of the mother. Kaya po, after the delivery of the baby ko madetoy. Okay? Isungod nga ipaikat tayo di bra ni nanang kasi masapul nga awan tibado na tano bare skin di jayanti barukong ni mother so that the skin of the mother can be in contact with the skin of the newborn as well. Okay? So pag dikitan tayo di barukong di ubing, ken di barukong ni nanang kasi laglagipan niya, the mother is exposed to tremendous amounts of pain. Okay? Nabanbandog ni mother nga nagididek, so nga nabara paimet di bagina. No pinagdikit yo di ubing, ken di nanang nga nabara ti bagina, the warmth of the mother is enough to insulate the newborn. So nya ti brain tayo tulaengen no na pag skin to skin contact tayon, we just give a bonnet to the newborn. Ikan tayo lang kalugongnan to protect the head from heat loss. And then we both wrap the mother and the mother and the baby with a blanket. Ulesan tayo laing isuda nga duwada ken ni nanang. That is now enough to help prevent heat loss in the newborn. Okay. So laglagipan nyo dry the newborn at once using a towel and then wrap and cover the baby. And then expose the baby in either floor lamps or radiant warmers no masapol. Okay, example niya, mapanagsukat ni nanang. Mapanag-CR, mapanagdigos, example. Okay, kasanon sir, laminin na nagiubingin. Pwede po natin gamitan ng floor lamp yung bata. Yung floor lamp po, iso dagiji kas lampara nga dati silaw na, tas ako majipyek, di ba ikantayo ti bumbilya DJ, tanuhan nga lami isen. That is the same principle in using floor lamps or what we call radiant warmers. Okay? You can also place the newborn on the parent's arms as long as breathing is already stable. So mabalintayon apo nga ipaubaken ni mother, okay? Pa-embrace ken ni mother and dejay nga ubing as if the child is breathing. Ngem no hanggang angis di ubing ake, kailangan po natin siyang kunin for resuscitation. So remember niya nga maganda pong ibigay natin yung bata sa magulang immediately so that the mother can cuddle the child because number one, it conserves heat, tano hang alamin ng ubing, and then it also promotes bonding between the mother and the child. Next, aside from that, we can also do kangaroo care. Okay, ito ay ginagawa natin after pinanganak yung bata, natanggal na si mother and the newborn sa delivery room, nandun na sila sa OB ward, pwede natin gawin itong kangaroo care. The kangaroo care is done to insulate the baby using the bodily heat of another individual. So again, papabudutin tayo di ubing, pero gumagamit tayo ng body heat ng ibang tao. And ang maganda dito sa kangaroo care is that it can be done by any relative that is available. So, bakit maganda ang kangaroo care? Is because aside from heat conservation, it also allows bonding with the neonate. Napaka-importante po na maka-establish tayo ng parent-child relationship on the early days of the newborn's life. Okay? So anong ginagawa natin? Paano natin ginagawa yung kangaroo care? Number one is that the neonates' chests are exposed. So tinatanggal po natin yung damit ng bata. And then the next thing that we are going to do, pag na-expose na natin yung chest ng newborn, is the mother will sit on a comfortable position. So ag-recline ni mother rin. Okay, agtugaw suna or ag-recline isunan. Okay, agsanggir. Okay? And then the chest of the mother is also exposed. So kas nag-skin-to-skin contact na lang. The neonate's chest is placed directly in contact with the exposed chest of the mother, and then both neonate and the mother are given blanket to cover them. Okay? Adadag jita duma agusar dati expandable bando tube or bando brasier which may be used in kangaroo care. Okay? And then habang ububrain da dati kangaroo care, they have to make sure that the mouth and the nose of the baby is still visible kasi baka din yung panda dito yan ti chesen ke na yung kastagayang hindi yan ti warukong di juro pa yung ubing hindi hanga nakaangis sunan. So when you're doing kangaroo care, it is important that the mouth and nose of the newborn is still visible to the mother to ensure that the baby is breathing. Kasta apot itsura na ti kangaroo care. Makita yo ke deta mother nakachubso na tinalawa. Dita nga nakaikabil de jay ubing. Okay, so the heat of the mother's body will also help uh, regulate the temperature of the newborn. So, pwede din again na pwede din siyang gawin ng tatay or any other relative available. Basta exposed po yung chest nila, pagdikitin yung chest ni newborn, chest ng magulang, you apply a towel or bando tube and then magre-recline position po siya. Alright. Next. Pag nagawa na po natin yung thermoregulation, the next thing that we need to do is establish and maintain patent airway or respiration. So, no na simpata yu dejian, hanlaki di nga lamin deji ubingin, the next thing that we will do is check if the child is breathing. Okay. Sabi dito, do not suction the baby if the baby is able to cry. So, hindi kailangan pong suctioning immediately. Okay? No deji ubing ket cry, agkra-cry, agsangsangit. If the baby is pink or if the baby has normal breathing, do not suction that newborn. Because the baby can expel mucus or other secretions by himself through the extrusion reflex. Dito tilaglagipin nyo kanayon haan nga insigida nga masuction dejo ubingen if the baby is crying, the baby is pink, or if the baby is already breathing, no need to suction. Next. Ang EINC recommendations po is that suctioning of the mouth and the nose should not be done for babies born of a clear amniotic fluid. So, dinagdagan po yung mga recommendations ng EINC. According to them, pag yung bata po ay merong clear amniotic fluid, wala namang meconium stain, there is no need to suction the newborn. So, 4 po yung susundin natin na reasons kung bakit hindi kailangan yung suctioning. If the baby is crying, if the baby is pink, if there is normal breathing, and if there is clear amniotic fluid, no need to suction. Okay. If the baby is not breathing, kung hindi siya humihinga, when di agangis ke, aggagasp suna, when di kasla ko malmalmes. Kasi nga agangis, agan anang sab. Or if the respiratory rate is more than 60 or less than 30 cycles per minute or meron siyang grunting sound, no agangis so nakikasla dati magilgiling, okay? Those are pangit na assessment sa bata. That's the only time that you use the bulb aspirator. So kailangan na po natin mag-suction pag hindi humihinga yung bata, naggagasp siya, kasi nga gangis, or nga to ti RR na ti 60 or nabababangin 30 or dati grunting sounds na, that's the time that we use the bulb aspiration to remove the secretions. Okay, so what do you do when you suction the newborn? You put the baby on the side and then rub the hand firmly on the baby's back to help them excrete the secretions. No kaya yung may katapo dagi secretions na di ubing pagsikigan nyo, mabaling nga i-rub yu di yan tibak na, ta ano han nga no nakaidagamin, ta rumwar dagi secretions, mabaling nga mapandya agong na mailaing ang subli, it will go back to the lungs. So dapat pagsikigan nyo, para po mag-flow naturally yung secretions out of the mouth and the nose of the child. And then rub the back. Okay? And then while doing that, mabaling nga sa bubble aspirator kayong tumit din. Okay. Like I said, you do not have to hit the baby or hold the baby upside down. Pabitinan da nga kasi sa dasipatan ube na just to make him cry. Okay? Paano ba magpaiyak ng bata? Sabihin mo, hindi kita mahal, charing. Okay? Paano ba magpaiyak ng bata? You just rub the back of the newborn. Okay? Now, pag may mga nagpapasuction po sa inyo na mga doctor, sabihin niyo, sir, the patient will need suctioning. Always remember po na pag hindi kayo sanay mag-suction, sabihin nyo, Doc, I'm not yet ready to do suctioning. Kasi pag gumawa po kayo ng suctioning na hindi po kayo marunong, that can lead to more harm than good. At aduti maaramid yung problema kaysa matulungan nyo dayjay ubing. Now, always remember that vigorous suctioning can lead to irritation of the mucous membrane. No dayjay mesa nga midwife naranggas unay nga agsaksyon. Okay la, dugsul na talaga kita saksyonen. Okay? Pero di agong ken ngiwat di ubing. That can lead to irritation of the mucous membrane. Mabalin na po nga masugat dayjay. Mabalin nga masugat dayjay yan ti mouth and nose na dayjay ubing, and that can lead to further infection. So nga hanga dapat nga naranggas ti pinag saksyon dayjay midwife. Okay. Next, you also have to look into the SWOF nga kunada super watch out for. Do tatay di watch out for kay gisisem pay laeng. Dito'y super watch out for bugsang sangitin. Kanyo. Okay. Meconium stained babies. Pag yung bata po pinanganak tapos yung kanyang amniotic fluid ay color green. Ibig sabihin merong meconium na naghalo sa amniotic fluid. That is the time that we intubate the newborn for deep tracheal suctioning. Hanga mabalinin apo nga dayjay na rabaw laing nga suctioning ti pamayan because the meconium is very irritating to the lung tissues of the child. Pag yung meconium po pumunta sa lungs ng bata, maaaring mag-collapse yung lungs ng newborn. So dapat tinatanggal natin lahat. So i-deep tracheal suctioning natin yung bata para matanggal lahat ng mga meconium na bumara sa may bronchioles niya. Para matanggal hindi pumunta sa lungs. So laglagipin nyo apo once that the child's amniotic fluid is already colored green, that is the time that we do deep tracheal suctioning because meconium can lead to lung collapse or collapse of the lung tissues. Now, laglagipin nyo pa apo that when you are doing suctioning, adati ko namin nga reflex gasp. The reflex gasp is that yung bata magagasp siya for air if the nostrils are suctioned or nasi-stimulate po dito. So imagine na madugsul ka no diyanti agong di ubing, the child will do gasping. Kunana. Iso nga very important nga no ag-suction tayo, we start the suctioning in the mouth before the nose. Apay kastoy dayjay. Laglagipin yung adati ko na tayo nga reflex gasp niya. Okay. Dayjay reflex gasp salang rumar dayjay no masagid dayjay yan ti agong ti ubing. Okay. Imagine adda pay laeng ti karga nga as nga secretions ti yan ti ngiwat. Adamit secretions ti yan ti agong. Si nga midwife hanggang nga dimdimngeg ka dayjay discussion ko, so kanya tinubram. Sinaksyon mo in sige dayjay agong. Kanya tinapasamak nag-reflex gasp dayjay ubing. Adda ba secretions ti ngiwat? Yes. In suction mo dyan agong na, niya tinubra jubing. Una na, so nasuloy na aminin nga secretions in the mouth. Tatan, no si kake midwife nga nalaing, dimdimngeg ka, iti nag-discuss ni Sir Jeff. Amom nga di ubing, jingiwat na kaya dati secretions. Di agong na kita dati secretions. Ngem gapong aruta dimngeg ka kada discussion ko, you suction the mouth first. Tinanggal mo yung secretions on the mouth. Okay. And then, nung nawala na yung secretions on the mouth, next na ginawa mo, sinaction mo yung ilong. Kanya tinuramid yung ubing. Nag-reflex gas. Kunana. Meron ba siyang na-aspirate? Wala na. Kasi nga, inuna mo po na tinanggal yung laman ng bunganga before ka nag-suction ng ilong to stimulate the gasping. Nawatan may lang. I hope that I am clear. Raise your hand. Dunawatan yung metlaing deje nga discussion ko. That is the reason why we suction the mouth first before the nose. Okay? To prevent aspiration caused by the reflex gasping. Duble na, no ma-aspirate jagong, kunay ubing. Okay? Sa inyo ito, brain tayo nga rod. Umuna tayo nga dalusan jingiwat, no i-suction de jagong na, kunana, wala na pong ma-aspirate. So that is the reason why we aspirate the mouth first before the nose. Next. Ito po yung tinatawag natin na nasal catheter. Ito po yung ini-insert natin sa ilong ng bata to remove the secretions using the suction apparatus. Ito po yung tinatawag natin na suction machine or suction apparatus. So dito po sa tubo na ito, agkunot deta. Okay, ikabit tayo deta di GNT tubo, deta suction tubing or nasal catheter. And then deta kunot. And then it is inserted this way. Again, kailan lang tayo pwedeng mag-suction? Ay, kailan tayo hindi magsa-suction? If the child is breathing, if the child is crying, if, ano pa po? If there is clear amniotic fluid. Okay, ano pa yung isa? Kubli tayo. Crying, normal breathing, and clear amniotic fluid. Those are the things that will prompt you not to suction the newborn. Pero pag may isa doon, may problema, that's the time that we suction the newborn. Okay. Now, ano yung mga pwedeng mangyari if suctioning is inexpertly done? Nag-suction ka, hamo may amuti inububram, dagito iti mabalin nga mapasamak ka di ubing. If you did not do suctioning properly, it can lead to bradycardia on the newborn. Mabaling nga bumuntog di pinagpitik ti puso na, or that can also cause apnea, ang agangis di ubingen because of poor suctioning techniques. It can also lead to vagal-induced bradycardia. So, bumuntog, di heartbeat na because of the stimulation of the vagus nerve nga makita tayo dito yan ti asidegti karabukob. Okay? Ano pa? There is also slow rise in oxygen saturation. Apa yung nagbasimiten ti blood oxygen level nan? Nagmamin, suction kami nga suction nga hanga no. Okay? So, oxygen concentrations in the blood is slower to rise because oxygen is being sucked out by the suction catheter. Nga hamumi, nga mo nga ububrain, nga ususaren. And it can also cause mucosal trauma which can possibly lead to risk for infection. So again, kung hindi po kayo marunong pa na mag-suction, tell your supervisor, tell your CI or tell your doctor, Doc, I'm not yet expert when it comes to suctioning. Kasi like I said, adado ti marami yung problema kaysa matulungan nyo di ubing no ag-suction kayong hanyong amuti ububraan nyo. Now, the next thing that we are going to do after po na ma-clear natin yung airway is we properly clamp and cut the cord. Okay? Ito Brian tayo. Dati-dati ti pamayamin, rumarjo ubing, clamp cut po namin insigidan. Pero hindi na po ngayon. Now, we have to clamp the cord once it stops pulsating. Laglagi penyo nga sa tayo laing i-clamp apo deji cord no haanen ngagpulpulso deji yen. Ti pamayan nyo, no rimwar deji ubing, di ba, after delivery, rimwar deji ubingen niya, iparabaw yu deji ubing, di jayan ti chan ni mother. Deji mesa, that one of the midwives will hold the umbilical cord. Igaman na umbilical cord, na ay nagipulso. No, at dapay lang ti pulso, hindi pa pwedeng i-clamp yung cord. So while waiting, dejay nga i-thorough drying danto dejay ubingen. Dejay nga i-assess danto dejay temperature kada dejay APGAR Score nan, kada airway nan. So yun po yun. So after 2 to 3 minutes, agsardeng pun ngagpitik dejay umbilical cord. And when that happens, that's the time that we clamp and cut the cord. Sir, aping nga iuray tayo met nga agsardeng di pinagpulso dejay umbilical cord before we cut it. Laglagipin nyo apo nga the child will not immediately breathe after delivery. Handa min sigida nga aganges kita. So kaya nasawen, mabaling nga na rigrigat danto nga i-control the oxygen da. So while the placenta is still sending oxygenated blood to the newborn, di ka di? Pitik pa lang namin di umbilical cord eh. So nga meaning di placenta agipadpadala pa lang so na ti oxygenated blood ka di ubing. Ka di ubing hamping agang angis. Hayaan lang natin that the child is still using the placenta to increase the oxygen level. Ngayon nung nagsangit di ubingen, di ka di agsangit to medyo ubingen, agangis to meten, that's the time agsarding tun ngagpitik di umbilical cord, that's the time that we stop. Cut it, we cut and clamp it kasi ususarin tumiten di ubingin di lungs na. I hope that's clear. Okay, so again, only clamp and cut the cord once it stops pulsating for more oxygenated blood to go to the baby while waiting for the lungs to take its function. Pero pag yung bata po, pinanganak siya na merong jaundice, color yellow de ubing nga rimwar, we do not wait for the cord to stop pulsating. I-cut clamp tayo in sigida de yan. Next. Pag nag-stop na po yung pulsating niya, anong gagawin natin is that we apply the cord clamp 1 to 1.5 inches above the abdomen. Okay? And then, after nga may pantayo di kelly clamp, di plastic di niya, 1 to 1.5 inches above the abdomen, no na pantayo di yan, the next thing that we're going to do is apply the kelly forceps, which is 5 inches above the cord clamp. Okay? The kelly clamp on the maternal side should not be released. Dapat hanyo nga ikaten DJ clampen DJ niya after cutting the cord because the blood will leak out. Tapo nakadardaran to di delivery room no. DJ clamp na nakakabit ka DJ ti umbilical cord nga mapankin ni mother ket inikat yu apog dara DJ nga permi. Okay? So when you are cutting the cord, you note for the completeness of the blood vessel. Dapat apo no ginetteng yu di cord, siripen yu kitain yu metlang no dati talo nga blood vessels di jay. Those are the 2 arteries and 1 vein. No agkurang apo, you report immediately if there is a missing blood vessel. And then keep the cord dry until the cord falls off at the 7th to the 10th day of life. So nunalpasin apo di yan nga pinangkatyo kina pinangklampyon. Dapat i-maintain da nga na dry daging a cord. And it will automatically fall off after 7th to the 10th day of life. Immediately, or inuhan da nga guyuden deta, agtinag deta nga cord tumit laeng. Numatinag digi cord, numaikat digi corden niya, there will be a granulating area which will be seen on the abdomen of the child. Digi nagkonektaran na digi yanti cord, ken digi yanti chan digi ubing, makakita kayo ti dati kaslabasit nga tulduk. That is what we call the granulating area. It is a small pink dot where the cord was. Okay, nunod tayo nagkonektaran da. It may appear after the cord falls off and it will disappear after 24 to 48 hours upon the falling of the cord. No, hanga may cut deto, mabalindang agusar ti silver nitrate para mawala po yung granulating area na tinatawag natin. Pero usually, hindi na po natin ginagawa yan in the hospital. Now, always remember po that in the EINC guidelines for the care of the cord, what we do is we do not milk the cord towards the baby. Okay? Anya ti milking ako nada. Digi milking, kaya digi igamam digi cord, samo idurun dagi dara nga mapan digi yan ti ubing. Okay? I-milk da nga ikas jay. Okay? We do not do that anymore because milking towards the baby will cause the small blood vessels on the brain of the child to rupture. Tagamin, idurdurun mo met dagi dara. I hope I'm clear. Example ko man ya, gore kata mangala na ti example ko. Example ko ma detoy ti cord na detoy di ubing, detoy di yan ti newborn, detoy ni mother. Ipamayan da kami do mga midwife is gore kay accept ko lang ni doan wait lang. Ipamayan namin dagi siya do mga midwife. Apay madikibak na din. Previous. Okay. Ipamayan namin kita do mga midwives is no detoy kumadeji ubing, detoy ubing, detoy korda. Ipamayan da petanda detoy nga cord. And then idurunda nga mapan ken deji ubing. Ni adado ti dara nga mapan ken deji ubing kunada. That's what you call milking the cord. Kanga mabalin dejay. Kasi no idurun mo di nakadado nga dara nga mapan ka di ubing. Tendency is the small blood vessels on the capilla on the brain will also erupt or rupture. Kasi nga napaspas unay nga mapandag di dara, may durumit ag di dara nga mapandigiyan ti utek, pakpak una da diyan. So there will be rupture of the small blood vessels in the brain if you milk the cord towards the newborn. Next, you also observe for the oozing of blood. Okay? No, in-cut nyo kumadiji cord, makita yung adda ti rumrumarlat nga dara, di ba? In-clampion niya, in-cut yo, and then adala ti rumrumar nga dara, you can place a second tie or second cord clamp below the clamp that you placed. Example, no dati ko madejay ti cord di ubing. Inikan nyo ti clamp dita. 1 to 1.5 inches away from the abdomen. Makita yung cut yun, di ba? Dagdardaralat ta. The next thing that you can do, ag-apply kayo ti second clamp di jayan ti sirok na. That's the thing that you do if there is oozing of blood after clamping and cutting the cord. You apply a second tie or second clamp below the first clamp that you placed. Okay? Dry cord care is recommended. Anong ibig sabihin nito? Hindi na po pwede na naglalagay tayo ng mga pulbos, ng mga alcohol, betadine sa cord ng newborn. We just let it dry completely. Hindi na po uso ang maglagay ng alcohol. Kaya nga po, while we are still bathing the newborn, nagpadpadigos tayo ti ubing, haan nga mabalin nga padigusen tayo nga full bath, dejay ubing, no adapay lang nga nakakabit dejay cord na. And kaya laglagipin nyo dejay, if the cord of the newborn is still intact, okay, dejay pay laeng nga nakakabit, no full bath. Ang gagawin lang natin po is we just do TSB to the child if the cord has not yet fallen off. But kung natanggal na po yung kanyang cord, the next thing that you can do is you can, check ko DJ. Sorry. The next thing that you can do is you can already give full bath pag natanggal na po yung cord. Okay? So, hindi na po pwedeng maglagay ng any substance on the cord. Hindi na po pwedeng maglagay ng binder or barikes or big kiss because this can cause infection. Ang gusto lang po natin ay air drying of the cord. All right. I guess I will have to stop the discussion for today. And if we have time, we will again meet on Friday so that we can finish the discussion, right, on your essential newborn care in preparation for your Christmas vacation. So hopefully, I still have a few slides to go. Konting-konti na lang yung tatapusin ko po and then we will already take the midterm test. Okay? So, I hope you learned something from my discussion today. Sana po ay nag-enjoy kayo. So, next Friday, if you have time, we will again have a discussion and then I will upload the test. Okay? So, hangkay pa nga ag-exam to tatta ingana no next week. Okay? Kasi nga po, kailangan po munang itapusin ko yung discussion ko for this session and then I will give you the midterm test. All right. So before we go, I want you all to turn on your cameras so that we can have a picture taking. Pasensya na po ha, medyo may sakit ako ngayon eh. Ang ganda ni Ate Adame. Medyo may sakit ako ngayon kaya medyo umuubo ako. Fresh naman ng mga taong to. Sige, turn on your camera so that we can have a picture taking before we go. Alright? So, sana nag-enjoy po kayo sa klase natin for this evening. Sana meron pong natutunan. At sana hawak-hawak nyo po yung inyong mga modules habang nakikinig sa akin. Alright. Doan, Miss Madid, and the others, please turn on your cameras so that we can have a picture taking. Hanggang babainin. Kita nyo ni Adami na nakapimpintas. Alright, sige. At the count of 3. Alright, sige. 1, 2, 3, smile. Alright, again, maraming salamat po for joining the discussion for this evening. Again, we will have another set of discussion to finish our last session for the midterms and then ag midterm test kaiton. So with that being said, maraming salamat po for listening. Keep safe, God bless, and stay healthy. Bye-bye. Maraming salamat.
Bye, sir. Thank you, sir.
Thank you, sir.
Mayong araw din.
Thank you, sir.
Thank you, sir.